My plumber is amazing. He has been coming to fix my house every week for years. Now this might sound weird, but that's how many people talk about their therapists without giving it a second thought. Also, many more people go to therapy, and yet it seems like the number of people with mental health issues still increases steadily. Those two things combined could make you think that talk therapy might not be too effective. Hi, my name is Jan Mion, and this video is based on my 10 plus years of experience as a hypnotherapist, where I have learned why talk therapy just isn't enough for many people and what you can do instead to improve your results. But why does traditional therapy have these limitations, and what is it missing? And what does all of this have to do with hypnosis? Well, I'm going to tell you in this video. Now, for many people, their experience with talk therapy is that they make some progress, but then some core issues just remain unchanged. Many say after going to talk to someone, I know exactly what I should do, but still I don't do it. Maybe this sounds familiar. You went to a psychiatrist or a psychologist, you talked about your issues, maybe it has helped a bit, maybe you found out who or what caused your troubles, and maybe you even found solutions. But yet you continue to talk, but nothing fundamentally changes. But why does talk therapy have this problem of getting you from I know what I should do to actually doing it? You see, the big question with talk therapy is, who are we talking to? Because if you would ask the average therapist, he would say, well, I'm talking to my patient, as if there were just one. But in truth, none of us are of just one mind. What most people know is that we have a conscious and a subconscious mind. But what most don't know is how really different they are. The most important difference here is communication, because the conscious mind talks in words and ideas with knowledge. But the subconscious mind communicates with feelings and mental images. Well, at least I hope you don't hear your subconscious mind as voices inside your head. So when you talk about your problems, you look at yourself on a deeper level, you gain insights, you make the unconscious conscious, you get to know yourself better. But very often this doesn't help too much, because the knowing is done by the conscious mind, the head, so to speak. But if the subconscious mind doesn't understand those solutions you found, your heart's not in it. That's why you often don't feel differently in the long term by talking about your problems, because you do it in a language your subconscious mind doesn't understand. So the talk therapy approach makes the unconscious conscious, and sometimes that helps, but very often it's not enough. We need the other way around too. And it's also important to remember that one of the main things the conscious mind does is to inhibit impulses. So if you want to punch your boss in the face, it stops you from doing that. So it's basically the brake pedal of the mind. So by talking about and knowing the solution very well, by making it a really conscious effort, you step on the brake pedal really hard and wonder why you're not moving. The conscious mind also has almost no power over emotions other than repressing them, and it has very limited resources compared to the subconscious mind. That is why your willpower is so limited and why your subconscious mind is running the show most of the time. This is especially true with stressful or emotionally charged moments, or when you're not at full strength. That is where your good intentions go out of the window and your subconscious autopilot takes over. So all the smart knowledge in the world doesn't help you a bit if your subconscious mind is not convinced by it to do things differently. And of course, in traditional talk therapy, we sometimes convince the unconscious mind. But very often this is not focused on, and it happens more by chance than consciously. What you will find with many successful psychologists is that they naturally have a very hypnotic way of speaking, or they put on a hypnotic voice when they switch to therapist mode. So there is no psychotherapy without talking to the subconscious mind. But if there is too little, or if it's not focused enough, then it's not as effective as it could be. So what we need to do in order to make lasting and actual progress is to change the recipient of our messages and suggestions. But as I said before, the subconscious mind doesn't speak in words and abstract concepts, so we need to change our way of communication. And that is exactly why hypnosis is so successful in psychotherapy. Because we can talk to the conscious mind like in regular talk therapy, but then we can go on and take those insights, your wants, your needs, and translate them hypnotically into something that your subconscious mind actually understands. So instead of all the blah blah for the conscious mind, we can hyper focus our suggestions at the subconscious mind, which is actually able to make lasting change and to do so on an emotional level. It can put theory into practice, so to speak. So hypnotherapy is basically psychotherapy plus, where we can induce change in the part of the mind which it actually is in charge of feelings and impulses. Or in other words, if you could change it with your conscious mind alone, you wouldn't have gone to therapy in the first place. Now you might ask yourself, but if hypnosis is so effective, why are not more people using it? That is a very good question that I have also asked the psychologists and psychiatrists who came to me for hypnosis. And there's mostly two reasons. The first one is that it just doesn't get taught in universities very often. And the other one has to do with the bad reputation that hypnosis still has. Because many still hold the uneducated belief that hypnosis is akin to mind control or magic. And so many therapists don't know how beneficial it could be for their clients. And also they are reluctant to learn it. What is funny to me in this regard is that many of the psychological community have realized that therapy works better with a hypnotic component. But instead of using hypnosis, they are now starting to prove that it improves the outcome of therapy sessions if they give their patients magic mushrooms. And of course, either way of opening the mind is fine by me, as long as you recognize that it makes things better. So finally, you might ask yourself, should I do hypnosis now? And for most people, the answer is yes, because we can not only use it to solve problems, but also to improve the good stuff like sleep, motivation, and so on. And so there is a benefit in it for practically everyone. Just remember, just as there are bad psychologists, there are bad hypnotherapists. And because of the outdated reputation of hypnosis, it attracts many weirdos. So make sure to seek out someone who seems halfway professional. And if they say or do something that doesn't feel right for you, then listen to your gut feeling, listen to your subconscious, and just don't go there. In conclusion, the most important thing for you to take away from this video is that everything the subconscious mind can do, it can also not do, and the other way around. So even if other things have not worked before, there is always the possibility for change, if done correctly. So that's all. Maybe leave a comment, leave a like, and subscribe, and see you soon.